Hello, everyone. Thanks for joining so early. This is Melissa Moorhead with Dash. I'd just like to invite you to use your phone or a handy internet-connected device to go to www.menti.com, MENTI.com, and use a code 856950. We'll have a couple basic questions to help identify who's on the call and find out where we have some commonalities. Thanks those of you who have joined so early, and we will be starting off right about 3.
Hello. I can't hear anyone. Am I supposed to? Is this how that works?
Stephanie,
but I can't hear anyone else. That's okay.
Stephanie, we're gonna get everybody. We'll get started in just a couple of minutes. Thanks for joining. We're gonna start right on time at the top of the hour.
Hello? Hello?
Hi, everyone. It is now the top of the hour, which means that we're going to get the webinar started. My name is Peter Eckert. I'm at the Illinois Public Health Institute, where in partnership with the Michigan Public Health Institute, we run data across sectors for health. So on behalf of the entire DASH team, and we'll throw our pictures up in a few minutes, I'd like to say thank you for your time today, but really thank you for your willingness to go through the work to apply for DASH funding. I know that getting funding is a great thing. I also know that it takes quite a bit of work. And even though it took a lot of work to get to this point, you and we know that the biggest part of the work is still to come. And so I'm going to do a couple of real quick introductory slides and then turn it over to the rest of the team. We're going to have an opportunity after I talk about DASH for you to get to know each other with a lightning round, and then we'll talk about the kind of support and activities that you will expect as a member of this cohort, and then we're going to quickly welcome you into All-In the Data for Community Health and the platform there. So if you'll go to the next step, then Melissa. So as I said real briefly, Data Across Sectors for Health is a national program office supported by the Robert Wood Johnson Foundation. We just recently celebrated our 5th birthday, and with that 5th birthday, we both we celebrated the work that we've done so far, and we also are pivoting into some new work also, and there it is, I'll talk about it there. So for the first 5 years of our activities, DASH has encompassed 3 primary strategies. The first of which is to build local capacity. So the activity that all of you are engaged with through the Kickstart program is really where that funding support comes. We're intending to support the capacity in your own communities to do multi-sector data sharing and collaboration. The second strategy, and again, you can contribute to this through your participation, is to build the evidence base for what works and what doesn't for this multi-sector work. And so that is the primary place where the liaisons on our team in their communications with you, together we're going to be building that evidence base. And then finally, all of us together are building this national movement to try to bring health, equity, and wellness to more and more people through this multi-sector approach. As a part of DASH's work going forward, we are now sort of taking what we've learned in all of the local communities, and we're applying a new lens to it. We've recognized, and the foundation has recognized, that by our own activities, we can't possibly move the needle nationally. So even though a lot of the DASH work in the past has really successfully raised the increase of capacity in the local communities, we can't possibly fund every community to do that. And so as we move forward with a lot of the same programs that we have done now, we are taking a policy and systems change lens, and your work is kind of an introduction to that. Before I toss it over to Melissa, I do want to talk about sort of how we think about how collaboration and capacity gets built. So as all of you know, in order to do work locally, especially multi-sector work, you have to form that collaboration. And that collaboration formation happens around people discussing and agreeing to a shared value. So all of you have already gotten to that place in your work, or you wouldn't have been eligible to apply for Kickstart funding. Now, a lot of you are in this place where you may still be doing some collaboration formation work, but you're also starting to work on developing a shared electronic system, and whether you're in the planning stage or you're in the building stage, your activities are around the shared data. Once you have those systems in place, you'll be able to act together in your intervention. So whether that's a policy intervention or a research intervention or a community program intervention, you'll be doing that together. And then finally, and this is especially important to the Robert Wood Johnson Foundation now, the work that you're doing is building up your capacity to sort of work together in the future around shared outcomes. And that's really what we think of as the holy grail of this work, when community organizations and collaborations are really working together in a way that they share the risk and reward of these really complicated activities. And so that's just the quickest overview of where we're at right now with DASH and our most recent renewal of award with the foundation. You are joining us at a really important time in our history, and hopefully it will be an experience that's equally valuable for you. And with that, I'll send it to Melissa Moorhead.
Thanks, Peter, and thanks everyone for joining us. We are happy to have you join a group of awardees through multiple funding programs through DASH. And we know it can be hard to orient yourself with all the different activities that DASH does, and our collaboration with other national program offices through All In, which Anna will be addressing a little bit later. But here's just an idea to give you an idea of the different kinds of things that we have funded and are funding and plan to fund moving forward as part of our building the evidence-based work, but also to answer to our primary mission of increasing community capacity to share data across sectors for health. So we have the Kickstart contracts. This is the 5th round. That's why we've been calling it Kickstart 5. There you will hopefully have opportunities to learn more about previously funded programs, get to know each other a little bit better on this call. And then also you may have colleagues and learn about others who are participating in our mentorship program and have opportunities to learn from some of the activities that are going on there. Specific to the Kickstart activities, here's a little slide to put some faces to names that you'll see coming through in your email or here presenting on webinars, or getting some outreach. Peter is the co-director located in Illinois at the Public Health Institute, and Claire Tanner is co-director here in Michigan. Underneath, you'll see the community liaisons. Hopefully you've talked to at least 1 or 2 of us already by this call. And also in the Michigan office, we have Stephanie Johnson, who manages the online community for All In, which we'll get to later, but apparently she can't hear us, so she won't be presenting on that. But she's someone who you can reach out to if you have questions about All In. So now I'd like to go and look at some of the answers to the questions that we asked you to be filling in as we were waiting to get started. Again, if you go to menti.com and use code 856950, we'll start having a live interaction of the answers to the questions. So we have an even number right now of projects that are driven by healthcare delivery system and social and human services. And then we have public health, education, housing and homeless, and community-based social services. Another one coming in for social or human services, which is great to see. And it looks like we have a community-based social service as well. And that does reflect our intention to sort of spread the love and attention outside of the healthcare systems and really recognize the role that community-based organizations play in building a culture of health through sharing data. Can we look at the next question? Oh, we got another one for human services. Thank you, Swati. So it looks like we have some really robust partnerships already. That's great to see. I wanted to have this out here for people to take a quick look at so you can see what kind of partnerships are possible. Again, we will be happy to support opportunities for you to connect with each other on a variety of questions, including if you have a specific interest in what kind of work your fellow awardees have done with organizations in these different sectors. Perhaps you can follow up with them later and find out what it took to engage them or what the actual work is about. And we've had an ongoing interest in including criminal justice and law enforcement data in these types of multi-sector partnerships. And I wanted to highlight that we do have some people who have already made some strides partnering with that sector. Next question, please. So we will ask you in more detail later on in the course of your award about data sources and data users. But again, here's another way that we like to connect different projects and communities on what systems they're using for different types of the for different projects and use cases. So we've got a lot of people in, of course, using electronic health records and have some data coming in from behavioral and mental health, which is great. I know it can be a real challenge. Housing and claims data being another pretty big source of data for a number of projects, both historically and in this cohort. Next slide, please. And finally, I wanted to take a look at some of those primary use cases for the shared data in your project. And I'll just take a moment and let them come up and let you take a look at those. A lot of care coordination. And then a couple of the place-based population health level use cases as well. So again, there's people who are doing work on all kinds of different use cases for shared data, both as part of this project, but also beyond. So that's why we love hearing about your collaboration as well as your DASH project as we move on. So I think we can go ahead and get started with some actual introductions. Let me go ahead and show my screen. Again, to remind you of the ground rules, thank you all for giving us some slides with some basic information about your project. We also have created a document with project profiles, which we can share with you to help you connect with each other after this. But we'll give you each about 2 minutes. Swati will be unmuting the designated speaker. Please listen for a chime that tells you when the speaker is up. And as you're listening, go ahead and jot down any questions you might have, because at the end we'll have a Q&A where you can ask the other presenters questions about their projects. So we'll go ahead and start off, Swati, I think with you.
Hi, everyone. Actually, not with me. We're going to be starting off with Tracy. Tracy, you are unmuted, so you should be able to speak and we should be able to hear you.
Okay, I'm Tracy. Can everyone hear me?
Yep, we can hear you.
Great. I'm Tracy Wyman with the Gulf Coast Community Design Studio, and I've got Keezy Jones here with me as well with the Design Studio. Joining us on the phone is Danielle Fastring. So MSU, the Gulf Coast Community Design Studio, is the lead in this project, but our partner organizations are the Gulf Coast Healthy Communities Collaborative, which has been building momentum for the past 4 years, and the Mississippi Gulf Coast Community Foundation. So in this project, we're going to be working to create a model for cross-sector data sharing that leads to funded place-based projects with evidence for community health impact. So basically, we're creating a local Kickstart opportunity with this Kickstart opportunity. And so we're going to be working with we're going to be developing some workshops and training folks on the relationship between the built environment and community health, encouraging cross-sector data sharing, and helping them substantiate their projects through community health data. And then we'll they'll submit letters of interest to us, and qualified teams that come together will then get to build a big idea that they'll present to an audience of a selection panel, but also an audience of potential funders, citizens in the community, as well as other community organizations and experts in the respective fields. 2 to 3 teams will be chosen, and we'll pass Kickstart funds on to them. And then from there, they'll have 3 months to basically kickstart their project, and the community foundation then really comes into play in helping to arrange and navigate a meeting between potential funding partners who can ensure the sustainability of their projects with each selected team.
Thanks, Tracy. That was awesome. I am going to go ahead and go back to muting you, and then we will have Betsy, who I can see is on, and have her speak. So just give me a few seconds to get this in. Betsy, you should be able to speak, and we should be able to hear you.
Yes, can you hear me?
Yep, it's a little quiet, so if you could try and speak up, that would be great.
Okay, I will try to stand closer to the microphone as well. My name is Betsy, and I am with our team today, Justine, Alex, and Taylor. And so we work for the Helpline Center, which is located in Sioux Falls, South Dakota. We are also the 211 provider for the state of South Dakota. And so what our project consists of is in the Sioux Falls area 4 years ago, we launched the Helpline Center Network of Care, which is a coordinated social service intake system. And so we started with 5 partner agencies, all sharing the same software for client documentation, client referrals, electronic referrals within the system. And over 4 years, we've grown to 18 partner agencies. So that's why from a partner organization perspective, I didn't know quite how to list that. So I just said community-based organizations. So we have faith-based organizations, we have healthcare, we have behavioral health, we have like furniture, we have homeless shelters as well, all within our partner organizations. And so last year, we had been documenting services and case notes and all that type of stuff, but we really saw a need of how do we understand the movement of someone from a social needs perspective. So we launched a social needs survey based off the Center for Medicaid and Medicare questions that were released in June of 2017. It's a client self-survey. They take it on an Amazon Fire when they present themselves at an agency. And then what we do is those survey results go into the system and are graphically represented. And then right now, 211 staff is doing follow-up calls to connect them. So they might be at a financial assistance appointment and only be seeing that, but based on their survey, they might have identified they haven't been to a doctor in a year. They might have a food insecurity. And so then we call them and connect them with additional resources and do follow-up calls. So with that, we want to build a behind-the-scenes portal for more agencies to be able to utilize that, understanding social needs from a holistic perspective and whole person care on what the client may not be able to verbally say, but how they answer these questions to identify. And then recruit more people into that portal so that we can start to see trends across the site, and then provide a platform on community discussions, because we're really reaching a population that might have not taken a survey by mail, but they're already at a location that they're receiving help from. And so our goal is to provide this technology platform, but on how do we identify and address social needs and relay that back to our community. So maybe all the surveys taken at XYZ agency, 50% of them also have mental health. So how can we bring services to that location, or other trends or needs that are arising?
Thank you, Betsy. That was awesome. So I'm going to go ahead and go back to muting you, and then I'm going to have Christopher and Kevin from Engage Well Harlem United speak up. Christopher, you are unmuted. Kevin, give me just a quick second. Kevin, you should also be unmuted. Hopefully you both can speak and we can hear you.
Good afternoon, everyone. This is Christopher, and yeah, I'm joined by Kevin Muir from the Engage Well IPA. Unfortunately, Kevin Rente from Harlem United could not be with us today. So we are a network of 18 health and human service organizations based in New York City. Harlem United is one of those agencies. And Harlem United is a multi-service organization. We have quite a few of those in our network who's providing primary care, primary specialty care to people with HIV. They also provide housing placement assistance. They are providing food services. They are providing legal services. They kind of run the gamut. We have a variety of agencies in our network, from very small harm reduction providers who are providing syringe exchange and harm reduction services to the substance using population. We have with 3 FQHCs, or federally qualified health centers, with 8 clinics throughout New York City. We have quite a few health home Medicaid care management agencies throughout our network. We have a series of food providers, food and nutrition, through pantries and congregate meals. And we all have come together, these 18 health and human service agencies, a few years ago in an IPA, or a independent provider association model, that is really trying to contract with healthcare payers. So that's managed care, that's ACOs, hospital systems, and trying to show return on investment for social services. Some of those things can be Medicaid billable currently. Some of those things are not currently Medicaid billable, but we know the evidence shows that if you provide these services, you will reduce utilization of high cost inpatient and emergency room services. So the network has kind of coalesced around the substance using population, and has been working together collaboratively for about 30 years, since the start of the epidemic for HIV here in New York City. So, this is the first time we are coming together to really think about what is the shared data that we all are already collecting, and what can we do with that data. We do have, interestingly, we have a connection to a system called CIC-START, which is a Medicaid behavioral health claims, that we have. The IPA has a level view of that data, and but not everyone in our network is providing behavioral health services, so we can't see everybody. We can't really track how members are using behavioral health services if they're not billing Medicaid for behavioral health services. So we are our goal is to start collecting common data elements. We share similar funders through Ryan White Part A programs, federal services. We have homeless services. We have OASIS, which is our substance use services. So we know we have common funders. So what we're trying to do is leverage regular data that we know everyone's collecting, comparing it, combining it, aggregating it through this new proof of concept database. And we hope that we can understand how our members are moving through the system, if they're duplicating services, if we know they're attributed to our primary care settings that aren't engaged in primary care, maybe they're showing up elsewhere in a social service care network, so we can identify out-of-network providers.
Christopher, I'm going to go back. I'm going to go ahead and unmute you. And we next have Sharon from Green and Healthy Homes Initiative. Sharon, just give me 1 minute to go ahead and unmute you.
All right.
You're now unmuted.
Can you hear me?
Yep. There's a little bit of a background noise, but I think we can hear you just fine.
I know. I'm sorry. I just came out of conference and I'm at a university center, so it's a little loud, so I apologize. But also,
no problem.
Across the country, we have our other team, Brendan Brown, and Annie Summers, Elsie Andrews, who will be working on the data portion. And I also have Catherine Klinger, who is our Vice President of Client Services, on the line. We are working with Shelby County Office of Sustainability, which is giving us a grant for a Master Home Environmentalist program, which will do a 1 to 2 hour assessment, comprehensive assessment of homes in a low-income community. And we'll be looking for behavioral, environmental hazards in the house. And this is about a 2 hour assessment that has about 14 pages of questions that we will now be able to put on tablets, and we're purchasing the tablets for these Master Home Environmentalists to take with them, which will eliminate the the errors in putting the answers on paper and then putting them into a system, which we are developing, and it's called Efforts to Outcome. And that's why our data team will be looking at all the questions, and we will be able to come up with a lot of reporting to find out where the disparities are in the house, what kind of health outcomes and barriers to good health outcomes are being found in the homes, and be able to share with others the increasing amount of quality data that we're collecting. And we want to especially learn from Boston Children's Hospital, who has been doing a program like this out in the field, and try to see, you know, what kind of information they found useful in their data collecting, and maybe mimic some of our reports to what they're doing, as well as reports that we know are outcomes that we're finding in Memphis and Shelby County.
Great, thank you, Sharon, and that was perfectly on time. So you have been muted, and I'm moving on to go ahead and unmute Julie from Hennepin County. And I will also unmute the rest of our team as well that I see that's on there. Julie and Peter, you're unmuted. Tyler, I don't think you're on, so I think it'll just be Julie and Peter from the team.
Hi, everyone. My name is Peter Bedertha. I'm an analyst here at Hennepin County, and I work with Julie on the opioid initiative, which is a cross-functional initiative to respond to the opioid epidemic here at Hennepin County. Can you guys hear me okay?
Yep, we can hear you just fine.
All right, great. Yeah, so our project comes out of some emerging analytics and evaluation needs that really dovetails with strategic direction at Hennepin County around analytics and data integration. So one of the things that we've found in recent years as we've been attempting to evaluate our initiatives around opioid-related interventions, things like medication for opioid use disorder, is when we want to evaluate things, one of the goals of many of these programs is to reduce emergency department utilization and reduce bookings in the Hennepin County Jail. Historically, these two data sources don't talk to each other. And in order to do these types of evaluations where those are the dual outcomes that people are primarily interested in, it takes a minimum of about 6 months to get all the data agreements put together, to merge the data and run the analysis. And our goal is to get that type of analysis down to a much shorter period of time, such that you could do it in a week if you needed to, provided that you had the right data permissions. And so our goal is to integrate emergency department and our jail data in such a way that it can be readily used for evaluation and analytics for to start with some of our opioid-related interventions. But ideally, this would provide the basis for doing evaluation and analytics in other areas as well, and also provide the basis for the start of an integrated data system here at Hennepin County. As far as deliverables, we're hoping to at least provide a summary of lessons learned, but our hope is as well that this data system will undergird a number of large evaluation initiatives that we have. I mean, one of them is the provision of medication for opioid use disorder at the Hennepin County Jail. And so it would be used widely beyond the initial scope of this project.
Thank you, Peter. That was great. So you're going to be unmuted as well. Julie, I'll go back to having you muted. Sorry, not unmuted. The next person that we have up is going to be Ted Rooney. So Ted, you are now unmuted.
Okay.
We should hear you. Oh, yep, we hear you.
Thank you. Hi, everybody. I'm Ted Rooney, and I'm working with the Maine Council on Aging on our municipal dashboard on healthy aging in communities. Maine's one of the oldest states in the nation. We have a larger, increasing number of older adults with few resources, less working age people, and fewer financial resources. Pensions going away and 401ks are just not the same. We realized in looking across the state that oftentimes the municipality is the one that is left dealing with an older adult with unmet needs when the healthcare system or the area agency aging or some other organization can't help someone. They often end up in the town office. And so we decided to put together a year-long task force to work with municipalities and the partners to see what can we all do to help address these unmet needs. And so out of that task force came the recommendation to develop municipal dashboards so we could help the municipality understand just what the unmet needs are of older adults in the community, develop an action guide on what to do about it, and then an education program sort of to help everybody see and how to come along. And the recommendation was to develop 4 to 6 pilots in communities. And while we're looking for funding and getting that going, we applied for this grant as a bridge to help us work with one community to develop a dashboard. And we chose South Portland, which since we sent in the slide, and they're our 4th largest city, but only about 25,000 people. But they have a lot of the major players there, the health system, Medicare Advantage plans, a really progressive area agency and aging, CAP program, public health, et cetera. And so we're going to be working with them both to develop a municipal dashboard with unmet needs, and by using the process of involving them on sharing data to help identify that, because there is no really one good place for data. We also want to involve them in the solutions that will come from that, so they start working together on the behalf of the customer, which is really the community and its residents.
Awesome. Thank you, Ted. That was great. I'm going to go back to muting you, and I'm going to move on to Bonnie and Amy as well. Bonnie, you should be unmuted. I'm hoping that you are able to speak up. Amy, you should also be muted or unmuted. Can you? Yeah, we can't hear you if you've unmuted yourself. See, Bonnie. Bonnie, I just saw that you were unmuted, but we can come back to St. Elizabeth and we'll move on to University of Pittsburgh. Liz, I know that you're on there, so give me 1 second. All right, Liz, you are unmuted, so you can go ahead and speak up.
Hi, can you hear me?
Yep, perfect.
Great. Hi, everyone. So my name is Liz Monk, and I work at the University of Pittsburgh, specifically at the Western Pennsylvania Regional Data Center, which is the host of the open data portal for the city and the county here. On this project, our team members are also Bob Graddick, who works with me here at the university, and then Dr. Kristen Ray from the Children's Hospital and the Pittsburgh study, which I will explain. Our project is to establish and expand the data partnerships that we have to support our work with the Pittsburgh study. So the Pittsburgh study is a community-partnered longitudinal research study led by the Children's Hospital that is supporting children in the county from birth through high school so that all children can graduate on time, healthy, and thriving. Our part of this study is that the data center is building a tool to help multi-sector partners and community members access data related to child health. Through this specific funding, we're building on our relationships with the Health Department, the Department of Human Services, the United Way, Pittsburgh Public Schools to share more data through the tool, and then also working to establish a data sharing agreement with Children's Hospital here. And then we will be gathering and sharing use cases related to the public use of the tool.
Great, thank you, Liz.
Yep.
All right. We are going to go on to Salt Lake, and the speaker for that will be Andrew. Andrew, you have been unmuted, so you should be able to speak up.
All right, perfect. Can you hear me?
Yep, we can hear you.
All right, awesome. So I'm Andrew from the Salt Lake County Health Department, specifically in the Population Health and Informatics Bureau. Many people know there's a wealth of data out there. There's a lot of data among our county agencies. And so one of the projects that we want to do is partner with our county agencies. And we've currently partnered with our information technology, the county jail system, health and human services, which includes the aging and adult services, youth services, and criminal justice. And we're hoping to partner with a lot more as the time goes on. But we want to create a centralized data bank on our county server with multiple agency access to that data. We currently have data from the jail system and the criminal justice, as well as our death data that's going to be going into that once it's built. And we're working with the information technology department here in the county to get that built for us. Along with the centralized data bank, we would like to create a master person index to allow for the assessment of multi-agency impacts on population health. So really what we're striving to do is create data links between all of these different data sets and databases that come into this centralized data bank, so that each agency can go in and create reports and promote health and safety for their community members that they serve. And currently we're working with the state health department to get an umbrella data sharing agreement so that we can have access to a lot of the data that we collect here as a county, but we cannot currently access that data without a prolonged request and individual DSAs. So we're working to get that umbrella DSA so we can have access to that data to put it into our data bank and provide access for all our different agencies, and then move on, once we have internal access, to move on to an external access where community partners will be able to see this data in the master person index. The data should be de-identified aggregate numbers, but they'll be able to pull out reports using Power BI and other statistical analysis software to hopefully benefit their customers.
Awesome. Thank you, Andrew. I'm going to go ahead and go back to muting you. And the next up, we will have the Greater Daytona Area Hospital Association with Lisa speaking on their behalf. Lisa, you are unmuted.
Great, thank you so much. And I'm assuming you can hear me?
Hear you.
Okay, great. So our project, the Greater Dayton Area Hospital Association, is just that. We are a hospital association, but are doing a lot of work convening community health initiatives. So outside of just traditional hospital partnerships. So we worked to get a grant through the Ohio Commission on Minority Health at the end of last year to start this year the Community Pathways Hub model here in Dayton, Ohio, which is a national model, but is started and really taken hold here in Ohio, which provides community health workers who work with at-risk populations for care coordination. Our grant through the commission is specifically focused on infant mortality and disparities in birth outcomes. The program, the Pathways program, is kind of a templated model that is wonderful that we'll be able to implement, but there are so many data sources for the information that we're bringing together. So we're really excited about this grant. As a part of the Pathway program, we have to use what's called a care coordination system. It's a software program, and we have to document everything about the client that we're working with in that system. But We'd like to be able to integrate with our local help link 211 from United Way so that we're bringing in reliable social services agencies into our system, and then being able to feed back out to public health, the FQHCs, the social service agencies who, for their own reporting purposes, may have data entry. We're trying to do our very best as we get the program started to minimize the duplication of data entry, but not all, as you've all said, not all of these systems talk currently. So introducing somebody new into the field and then trying to get them to talk is a challenge, but we're really excited to get that going. So we need to implement the care coordination system, provide training, education, and then really are looking at interoperability as we get that program launched.
Great. Thank you very much, Lisa. So I'm going to go back to having you muted. And next up, we have Sandy from the Howard County General Hospital. Sandy, give me just 1 second to unmute you. Go ahead. You are unmuted. You should be able to speak up.
Great, thanks so much. Howard County is located in Columbia, Maryland, or Howard County General Hospital is located in Columbia, Maryland, and we are partnering with the Howard County Fire and Rescue Services, the Howard County Health Department, the County Department of Community Resources and Services, and CRISP, which is the Maryland State Health Information Exchange, on a mobile integrated community health strategy. That's similar to a community paramedicine program. The goals of the program are really to identify high utilizer patients upstream and their psychosocial needs, and then connect them to services before they really even need to get to the point where they're utilizing healthcare services. Our goal is to hopefully identify rising risk patients and intervene and connect them to county resources that already exist, but where we don't know that currently we don't have the ability and the data infrastructure set up to understand where patients have already been referred, what is working and what is not. So through this program, we are in partnership. We're hoping to sort of bring together data sources from 5 different entities and really create data alignment through a standardized database, a data dictionary, and validated record linking. So as others have talked about, creating sort of a master patient index so that we can track patients across the various agencies and the various programs, including through bidirectional referral linkages to social services. And then we want to set up a dashboard with data analytics and some key performance indicators that the group have agreed on to really start to track program evaluation. And so we think that this program is going to do great work, but without the data and without really spending the time to make sure the data is in alignment and working towards our metrics, we don't have a great sense of knowing if we're actually making the impact we want to. So this Kickstart grant, we're really excited, is hopefully going to give us the resources to align all of these data sources and bring them together. And our biggest challenge that we are sort of pondering through is what is the best way to create a common patient or person identifier across the diverse data sets and the distinct entities. And so we are excited to learn from others on that as well and share our learnings. Thanks.
Thank you, Sandy. I'm going to go ahead and have you muted. And next up, we have Sasha. I hope I said your name properly. Give me 1 second to find you on our list. Sasha, I don't see you on here, so Anna, I'm going to go ahead and unmute you on our list, if that's okay. Anna, you are unmuted. You can go ahead and speak up.
I think Stacia may be under Mary Mullen Jones.
Oh, I just muted Mary Mullen Jones, so maybe that. Hi.
This is Stacia Scruggs.
And this is Mary Mullen Jones.
We're together.
You found both of us.
Oh, perfect.
Okay, so we're located in Fort Bend County, which is right on the outskirts of Houston, Texas. And we are part of the Fort Bend County Collaborative Information System, which is a group of nonprofits here in Fort Bend County. So we started out in 2014 with 6 nonprofits coming together to discuss how we can support the community and provide more services to them. And from that meeting, we yield a beneficiary assessment, which we conducted and had close to 1,100 individuals living in Fort Bend County take the survey. And from that survey, we found that the community needed to have an increased awareness of social services that are available to them. And we've also found out that our highest users of services are mothers between the ages of 24 and 44 living 50% below the poverty level. So from that, we decided to create what we call the OSCAR, which stands for the Online System for Coordinated Access and Referral. This will be an enhancement to what we currently have, which is called Caseworthy. That's the database that all of our nonprofits use, where we interface our information from each other, where clients come to receive services, be it veteran services, case management, food assistance. And so with the OSCAR tagged onto that database, our clients will be able to sign up for their appointments without coming into the office. They'll be able to upload data or documents that we need to serve them without coming to the office or seeing us face to face. So incorporating the OSCAR will allow us to increase the applicant's capacity of who we're serving, and will also eliminate unnecessary office visits and time off from work that our clients would have to take in order to come receive services. And so that is pretty much what we plan to do with the OSCAR.
Awesome. Thank you so much. I'm going to go ahead and have you both unmuted. Sorry, muted. And 1 second. Next up, we're going to have Bonnie and Amy try again. They're our last ones from St. Elizabeth. Bonnie and Amy, I'm going to go ahead and unmute you. Amy, you are unmuted, so you should be able to speak up.
Okay, this is Amy Brown. Can you hear
Yay.
me okay?
Yep, we can hear you perfectly.
Right. Bonnie had sent me a message that said she could hear us, but she was in a group setting to where she cannot really speak. So our team is Bonnie Hedrick, Dr. Victor Ronas Tobin from Xavier University. Emily Brinkman is in the room with me. Bridget Kramer, who I spelled her name wrong, it's with the K-R-E-M-E-R. Is our accounting person, but the lead agency is St. Elizabeth Healthcare. We're in Northern Kentucky, just across the Ohio River from Cincinnati, Ohio. Our partner agencies are Xavier University Center for Population Health, and we are also working with KIP, which is the Kentucky, I think it's Intervention Prevention Data, or REACH is the organization to provide some other data. So we have a group called Activating Hope. It's a collaborative that Bonnie and Victor are very active on, that is looking at the needs of students with mental health and suicide. And so we want to target our interventions to those groups. So we are going to analyze health data from the emergency rooms and then the KIP data to look at where we should be implementing strategies and programming in school districts to reduce mental health issues and suicide for young people.
Great. Thank you so much, Amy. I'm glad that we were able to hear your community introduction. So with that concludes our community introduction. So thank you, everybody. And I'm going to hand it back to Melissa for the DASH framework.
Thanks, Wafi. I appreciated everybody's succinct description of their projects, and I wonder if you're thinking, wow, there's a lot of different things going on in this one Kickstart cohort, as well as seeing some of the similarities. I would like to encourage you to chat in any questions that arose as people were giving those descriptions, and explain where you all fit in terms of one cohort. We are a learning organization still, and that's why you had the choice of choosing, of saying what your project goal was or what you hope to learn from others. We're still learning from you all about the different shared data use cases that are going to help promote a culture of health. And we see the work occurring in a sort of a basic framework here, which is also a work in progress in terms of understanding community data sharing capacity and the policy and market environment that underscores that. So there's actually a lot of work that's going on in the collaborations that underscore these projects, or that you're all working with, that I think touch on a lot of those different domains. And so it's another area for conversation that will help us both understand activities going on more broadly and make connections for you all to promote and progress your individual work across the nation. So the reason that I am continuing to refer to DASH as a learning organization and wanting to hear from you all is, again, because we really are interested in the positives and the less positive experiences you have as you are executing your projects and taking the next steps. You heard that not all of you are in the same spot, not all of you are in the same focus area, but we do believe that the general framework that we have will touch all of the work that you're doing, and that you will be moving into those areas together at some point. So, please keep that in mind as we go, and we'll help you make connections with each other and with others across the nation. So, I mentioned earlier, and we've talked about on our calls and in the introduction to this award program, the All-In Data for Community Health Peer Learning Collaborative. And I'll turn it over to Anna to discuss a little bit about that collaborative. Anna?
Great. Before we move on, I just wanted to pause and see if anyone has questions for each other. I know that was a really quick high-level introduction to all of the awardees, and I was super excited to see some natural connections that I think will jump out across communities. But before we move forward, did anyone have a question for another team, or a general question?
Mary, I see your hand is being raised, so I'm going to go ahead and unmute you so you can ask your question. You should be able to ask your question now.
So I would love, because I can't see across the table that well on this laptop, I would love to have copies of all of these slides so that I could read through them a little bit more carefully. So can you all send those out so we can see them?
Yep. Oh, sorry, go ahead.
And my other question too is, I'm looking at the agenda, and I see the names and so forth of the titles of the projects and so forth, but it'd be really helpful to have the name of the organization and where they're located on something like an agenda, maybe our next meeting. Just so I know, just for example, where I wrote it down, some of them, but a couple of them I missed, just so we have it for reference. Because I don't think a lot of people know where Fort Bend County is, but hopefully it helped to know that it was we were adjacent to Houston.
Yeah, so I'm going to take a pause and answer your question, and Anna might chime in case I miss anything out. So we will have a copy of the slides sent out in a follow-up email, along with the fact that the webinar is being recorded, and a few additional follow-up emails. As we were going through the PowerPoint or the webinar, I did add a second handout that's called a project profile. So on the project profile handout, it should be listed where each community is located. If that's not listed, then we can go ahead and update that and make sure we have an updated project profile sent out to you in a follow-up email. So there will be, so that information will be sent again after the webinar is over.
Great.
Does that answer your question?
Yes, it does.
And the profile it pulls from your the applications and summarizes the same information that y'all have been sharing in the presentation, just so you have a little cheat sheet to go back to about the other communities.
Wonderful. Thank you.
Great. Did anyone else have their hand up?
Oh, I do see a hand up. Oh, Mary, that was your hand. So anybody else?
Peter shared from Hennepin County in Minnesota. For the other data integration projects, I'm interested in hearing more about the data practice environment in their area and how they have or are navigating data practices and data sharing governance. Great. So that sounds like, Peter, like a topic that we could schedule a call across a couple communities. I know that it seemed like Salt Lake City was doing, or Salt Lake County was doing that, and I can't remember who else, but that's a great suggestion. And in follow-up to this, in the notes that Swati sends out, in follow-up to this webinar, we can ask who's interested in a conversation on that topic. So that's great. Anyone else? And there would seem to be another kind of natural theme around United Way and 211 data and referrals, and a couple of you that have these different kind of networks of CBOs and or social service and health providers or FQHCs. So that seems like another area where we could foster some connection. Great. So we can move on now. I know my name is Anna Barnes. I'm a senior program manager at the Chicago office at the Illinois Public Health Institute. I know a lot of you are already familiar with our national network, All In Data for Community Health, but I'm just going to quickly orient you to the opportunities that are available to you. So now that you're officially a DASH awardee, you have access to a national network of many more communities that are some further along, others just getting started in this space. So these current program partners are just some of our national partners. Many of those national partners also have grantees or funded communities that are members of the All-In network. Some of them, like the Network for Public Health Law, really serve in an advisory space to us. So if you have questions around privacy or consent or data sharing agreements, they're a great resource and are available for one-on-one conversations. We also have a legal bibliography or an online searchable database that we co-created with them that's available for your use. So moving on to the next slide. These are just some of the opportunities available. So we have a monthly newsletter that we send out, which highlights funding opportunities, research or publications of communities in the All-In network, as well as of our DASH awardees. We also have webinars where we invite communities to showcase their learnings. Some of you may have attended these webinars, but as your projects evolve, we really will be turning to you to share your learnings with a broader audience. So we curate those and we really listen for topics that are of interest across the larger network. We also host in-person meetings. So sometimes these, the topics of these are identified by the communities that we fund. In August of last year, we hosted a health and housing meeting and we brought together 10 community collaborations working in the health and housing space. and we plan to do more of these type of meetings in the future. We also, as a DASH awardee, you're encouraged to consider requesting another community for which you'd like to do a site visit. We have a process for planning those and for identifying shared learning objectives and goals for those visits. So you might have noted someone that presented earlier that you'd be in, or more than one community that you'd be interested in visiting. We'll share more information about the process for those visits. And then lastly, we have our online platform. We recently migrated to a great new space. There's been a lot of discussion and activity there, and we're going to show you in a minute briefly some of the functionality of that online community. So next slide. So really, just in summary, the All-In Network is just a larger space for you to find the resources or the communities that you need to connect with that will help jumpstart or leverage your work. There's so many communities that we have supported, and if you can't find something that you're looking for, let us know because we can help facilitate those connections. We really encourage you to dig around in the online community as a starting point and search the directory and the profiles and see if you aren't able to kind of make those connections on your own. If you can't find the people you're looking for, we can try to connect you as well. Great. So this is just a nice way to sort of depict sort of where DASH fits in to All-In and kind of who participates in All-In. So in the larger circle, this is just a different way to depict the first slide that we showed you, but really each of these national partners brings a network of communities with them into All-In. And so that's why the DASH grantees kind of sit in the middle. These are some of the ways in which we bring people together, which I've already talked about. The national meeting is something that it hasn't necessarily happened on exactly at a national basis, but we will be doing another convening sometime soon. We don't have the date yet for that. I also wanted to share, let's see. So we have other funding opportunities, which include our DASH Mentor Program and our affinity groups. The affinity groups are a space for connecting with others in the All-In community that have a similar interest as you. So, for example, we have one on community health dashboards, which I think is relevant for some of you. We have one on data law. There's one on substance use data, which also might be relevant for some of you. This is really just a different way to have conversations with communities in the All-In Network that are not DASH awardees. So anyone who is a practitioner in this space is welcome to join All-In on their own. And they may not be receiving any funding, but they might be an active participant in our network. So yeah, I think that's it. I think that in summary, just know that if you didn't hear, when we were doing the roll call of the Kickstart awardees for this round, if you didn't hear a lot of folks that you feel like have opportunities to connect, there's a much bigger network of folks out there that we can connect you to learn from. Great. So Melissa, you're going to do a little quick demo of the online community?
I'm sure going to try. Thank you very much. I think that a lot of you have already joined the online community, which is great. But I think it might be worthwhile to just take a moment to look at it together and talk about some of those ways to leverage it that we have mentioned. So with any luck, I am going to share my screen and I'll be live on the online community. So Anna described the ways in which All-In forms a peer learning collaborative. and that is supported by the program office staff where possible. But we really hope and promote the online community as a place for peer-to-peer connections and support to happen. So I'm already logged in, but if you haven't created a profile yet or logged in, when you come to the home screen, you'll be able to see a little sign up and log in link there. And when you do log in, when you do create an account and throughout your time in All In, we would like to ask you to tell us more about yourself in your profile. Your profile page for yourself, it has a wealth of information about some of your connections and contributions and that sort of thing. We're actually building out the profiles a little bit more. You'll notice I haven't provided additional details about myself, so I'm definitely not exhibiting the behavior that we'd like to see, but if you do put information in there, people will be able to find you based on keywords or things that you've mentioned that you're interested in, simply by going to the directory and doing a search for keywords or a company name, that sort of thing. Or to answer Mary's question, for example, you can also find people by the location, city or state, and bring up a list of people. Let's see how many people we have in Texas, although I'm not getting that drop down to work, so the danger of trying to do anything live. We have a sector search we could do instead, see how many people have identified education as part of their work or are from the education sector themselves. And it sort of gives you a short list to try to connect with right away. You can either send them a message or add them as a connection to talk more directly. So going back to the home page, the other way to find people or make these connections can be as easy as just asking a question in the forum, in the open forum community. So on the homepage, you can see the latest discussions taking place, and these are all posted by people who just had a question that they didn't know who would be the best responder to. So you'll notice someone asked a question about contracting and health equity, and it looks like someone has actually even posted something, an attachment to answer that question about their about what they have done to ensure that when they are contracting, they are attending to equity in that contract, which is an area that Dash is really interested in. So there are, you're welcome, as I mentioned, to go to the community home, the open forum, and just post a question when you not sure who you wanted to connect with. We do have a number of different communities. The open forum is the the one that everyone is automatically joined to, and therefore will give you the broadest audience. But we have a number of sub-communities as well that might help you get some attention from someone in a more specific way. We are adding a subcommunity for the Kickstart programs. That's another place you'll be able to find information about each other, as well as ask either the program office staff or each other some questions in a broader way like that. And we might start some discussions or themes on affinity groups or site visits within this particular cohort there as well. Data law is an open subcommunity that is run by the Network for Public Health Law that Anna mentioned, and Sally Milam has posted some resources and things in there and answers questions pretty quickly as they come in. So that said, we did have to move our online home from a platform that we had for several years that was allin.healthdoers.org. So you may see some materials floating around still or have had an opportunity to participate in that Health Doers element, but so we're still building out community.allindata.org to restore all the conversations and resources that had been uploaded there. However, you are welcome to participate in the new online home as you like. And if you have any questions about the online community or having any issues with it, again, Stephanie Johnson at the Michigan Public Health Institute is a person you can reach out to with any questions or asking about uploads or other kinds of platform questions. We all do monitor the discussions and messages as they come in as well to try to make sure to make connections where we can and help you out there. So that said, I think I have to go back to my presentation. So if you will bear with me just a moment.
Does anyone have a specific question about the online community while Melissa is navigating back to the slides?
I don't see.
Doesn't look like we do. I was going to say we are working on scheduling some short kind of demos or office hours so you can get a little more hand-holding if that's helpful with the online community. We've been learning that there are little tricks and tips such as like how to tag other communities or participants so that they see your post, and if they might have knowledge they can contribute, but little things just to make it to maximize the use of it. Great. So just in wrap up here, we wanted to just remind everyone of what the next steps are for your KIC award. These are short 6-month projects, so we know you're already off and running and finalizing your work plan and contract with your primary liaisons. Some of you have asked us questions about the capacity assessment. We do have a one-pager that we can send that summarizes the purpose of that, and we can provide further guidance around who should be taking the capacity assessment. If you haven't already, we will be sending the award letter once it's signed by your party and our party so that you can receive that initial check. You've probably already been in communication with your liaison about scheduling check-in calls. So those are getting populated in the calendar. I know our team is scheduling those calls every other month, but if you feel like you need more calls, we're happy to do so. If you can then go into the online platform and fill out your profile, we can invite you to join the CIC-START group. We will probably be posting topics on a monthly basis just to kind of feed some discussion and interaction across the communities. We'll also be following up with an email about this webinar and the materials, but also the next steps on the peer-to-peer site visit. So really for that piece, we typically look at who's interested, which communities we do matchmaker behind the scenes, because we don't want to schedule a lot of one-on-one conversations. If there's 2 or 3 or 3 or 4 communities that are interested in each other, we facilitate those or set up those calls to happen together, just to be mindful of everyone's limited availability and time. Once we have a peer-to-peer introductory call to kind of unpack where there's some shared learnings or what folks want to dive deeper in with each other, if there's alignment, then we will help to schedule a site visit date and pick a host community. And I think that's it. We have the newsletter as well as the Twitter that we use to promote information about what's going on with DASH and All In. We will also be at the Community Information Exchange Summit hosted by San Diego 211 in a couple weeks. So if any of you will be there, that's a great space to connect with DASH and All In. And 211 serves as one of our mentors. Do we have any other questions before we close out, we do have an evaluation for you to take when the webinar closes. But any burning questions just about this cohort itself or the greater All-In network? Okay, great. Well, we hope this was at least a helpful introductory level setting opportunity today, and we will sign off now and look forward to catching up with all of you in our upcoming monthly check-ins. Take care, everyone. Have a good afternoon.
Thanks, everyone.